Happy Tuesday, everybody. Good morning, and welcome to this week's episode of Tooth Teacher Tuesday. Dr. Zom here. This week we've got another episode of Oral Pathology Corner, and we'll jump right into it. This week I'm talking about a pathology finding called a mucocele. And what a mucocele is, you can kind of hear in the name the word mucus. And there's a reason for that, is because a mucocele is, we've talked about various different lumps and bumps in the mouth. Mucocele is a very specific type of bump in the mouth that is usually found around the lips or sometimes on the roof of the mouth, but the lips are the most common place. And it's a bump that's caused by some sort of trauma to a minor salivary gland in your lip or the roof of your mouth or wherever it may be. But that salivary gland, when it's ruptured, starts to release saliva, mucus, kind of underneath the tissues of your mouth. And it has nowhere to go, so it just kind of balloons up into this little kind of water balloon looking lesion that looks a little something like this. And you might be wondering, there's salivary glands in the roof of my mouth or in my lip? Yes, there are. They're minor salivary glands. Not intended to be an anatomy lecture, but you've got your major salivary glands that are found kind of in your cheeks and under your tongue. But there's also tiny multitudes of little salivary glands in the roof of your mouth and along your lips. And as I said, if these were to be traumatized by accidentally biting your lip or something, and those salivary glands rupture, they balloon up into these mucoceles. And so typically, these mucoceles are not a major concern. Most of the time, they will resolve themselves. The saliva will dissipate on its own and the bump will go down. But occasionally, if the leak is strong enough, they more or less maintain the same size or may continue to get bigger. And at that point, we usually recommend having them surgically removed. That makes it sound worse than it is, but just a simple little excision there to remove that and suture it up and you're good to go. But yeah, that's basically all there is to mucoceles. Yeah, I hope you found this useful, and we'll continue talking about various pathologies in future episodes. But until then, thank you for tuning in, and we'll see you on next week's episode of Tooth Teacher Tuesday. Have a great week.